When assessing the ankle joint, it is important to take into account any previous injuries, medical conditions, footwear, occupations, and sporting activities. Initially, the therapist will observe the feet and ankles, looking for bruising, swelling, abnormalities compared with the other foot, and also the position of the foot, such as overpronation or fallen arches. Next, the therapist will usually palpate or feel the area. They should be looking for tender or painful areas, swelling, scar tissue, changes in temperature, and muscular tightness. Commonly, the ligaments on the outside of the ankle are injured. The therapist will also often palpate the calf muscles to help assess their condition, as this often has an effect on ankle function. Next, range of motion will be observed. This is usually performed both actively, where the patient moves the ankle through its full range of motion, and passively, where the patient relaxes and the therapist moves the ankle. Any pain or decrease from the normal range of motion should be noted. Movements to be observed include plantar flexion and dorsiflexion, where the foot is pointed down and up respectively, and also inversion and eversion, where the sole of the foot is turned inwards and then outwards. Resisted movements should be performed to encourage the muscles to contract. The patient usually tries to move the ankle against the therapist's resistance. Pain on these movements can indicate muscular or tendon injuries. They can also give the therapist an idea of muscular strength. Finally, joint and injury-specific tests can be used. Examples include Thompson test for Achilles tendon tears, where the therapist squeezes the calf muscles to produce movement in the ankle, and also the anterior draw test, which tests the ligament support in the ankle. The therapist tries to move the foot forward of the lower leg. If the ligaments are intact, there should be very little movement.